Oh yeah.
Alright, imagine playing a sport one day and you strain or sprain a muscle. A typical healing process with the necessary rest for any strain or sprain is typically anywhere from 1 to 4 weeks. Let's say you have a championship game in a week and a strain that requires weeks rest. Well, cupping can cut those days rest to about 4 to 5 days instead of a week, and then you will be ready for the championship game. So, how cupping works and the pros to it. Cupping involves the use of cups applied to different areas of the patient's body in a series of positions in order to produce suction. The vacuum effect targets areas of skin and deep tissue within the back, which is good for reducing pain, breaking up scar tissue, and relaxing tender muscles or connective tissue. So the steps on how to cup a certain muscle. If I'm going to be cupping Diggins's muscle around beside his spine, so I'm going to come up here first. And so I suctioned it like that, and you can go to certain pressures by just going like that, and that releases the pressure. And I can go kind of mediocre or really tight. And this is right here is called stationary cupping, is when you leave them for a certain amount of time to really draw out the blood flow to the surface and circulate things, and most of the time will be in conjunction with massage to help it circulate the blood. So usually when the cup is stationary like this, I'll be massaging down here, or because this muscle is attached to his lats, I'll massage over here, because usually referred pain, if the cup is there, the referred pain will be over here. So when it's stationary, you massage at the same time. For moving them up and down the body, you usually take a little bit of ointment or cream just so it moves along the back or whatever muscle you're cupping easier. You get the right pressure, not too bad. Moving them is a quicker release of the muscle and separation of the fascia from each other in a more active type release versus the relaxed sensation of it being stationary. So for dragging them, you usually put it a little looser of a pressure, not too tight. So then you just go like this, and sometimes it just come undone, and just drag it slowly up and down the back, just like that. Now release it a little bit quicker than just letting it sit. How it feels for the patient, depending on who you are and how you tolerate pain, is a factor in how uncomfortable or relaxing this form of therapy can be. It also depends on how sore the muscle is. If a muscle is super inflamed and sore to touch, then chances are the cupping might be a bit uncomfortable. And if the muscle is not as bad, with some cases, with some aches and pains, then it should be more relaxing. How the blood circulates when using the cups. Typically areas of pain and soreness are usually inflamed and just need to be massaged out or cupped. So when you put the cups on an area of pain, it suctions the top layer of skin. Some people never mark, but some people leave a session of cupping looking like they've been dotted with baloney. So if you turn like that, that mark's already really red. So that means his blood is stagnated, which means that it's not getting good blood flow. So if I'm to cup a spot, let's say right here, and turn the camera, and if I'm to leave this cup for a few minutes and then I'm to take it off and it still looks like that, that means he's getting good blood flow. See the difference there? And usually whenever they're darker, that means the blood is more stagnated. So how long do the marks typically stay for? The cupping marks based on the severity of the stagnation of the blood and the inflammation of the muscle can stay anywhere from 24 hours to 2 weeks. The therapy of cupping has been used in China for thousands of years. At first, it was applied using cattle horns or cross sections of bamboo. To create negative pressure inside the horn or bamboo, these ancient cups were boiled in water, or fire was ignited to expel the air and suck the cups onto the skin. These cups were used mostly to draw out pus and blood in the treatment of boils. Cupping was originally used as an auxiliary method in traditional Chinese surgery. Later it was found to be useful in treating other diseases and developed into a special therapeutic method. There's three types of cupping. There's 3 types of cupping and three methods of cupping. The first type of cupping is flash cupping. Is where you move the cup up and down the skin fast, but when you move it up and down, the difference between gently dragging it like I did before and flash cupping is when you do flash cupping, you put the cup on, but it's not a gentle, slow motion. It's quick and take it off like that. So you've released the pressure, and then you quickly put it on again. And you usually do it 3 or 4 times. Go up and let go, and you do that 3 or 4 times. The second method, or the second type of cupping, is dynamic cupping, where you just attach to the skin and drag it gently, as I did before. And then the third one is static cupping, where you just attach it and let the blood really come to the surface. The methods of cupping, these are normal cups. They're plastic, or you can use silicone cups, where you suction them in like that and attach it to the skin. And then there's also fire cupping and water cupping. And all cupping lifts the tissue up and causes blood flow and oxygen to come into the area. The difference between the methods are basically the severities of how they feel on the body. So we started by talking about how cupping works and how it feels when they are on the body, and the types of cupping, and how finally to how cupping originated. Cupping is a great form of therapy and is used worldwide and has proven to be helpful for all sorts of injuries.